Hello and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, The ABCs of Effective Communication and Implementation of Policy. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, continuing education credit will only be awarded for 1 year for nurses, expiring on June 30th, 2017, and 2 years for social workers, expiring on June 30th, 2018. If you are watching this program on demand and want to receive a social work continuing education certificate, then you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you are watching this program live, there is no social work test required. I'm Renee Carpenter, State Social Work Director for the Alabama Department of Public Health, and with me is Graham Sisson, Jr., Director of the Governor's Office on Disability and Assistant Attorney General. We also have additional guests that will be joining us later in the program to demonstrate auxiliary aids and services. Welcome, everyone, and thank you for being here. Graham, let's get started.
Welcome. We're going to be covering a lot of information today. Again, my name is Graham Sisson. I'm Director of the Governor's Office on Disability. I'm going to be advancing the slides today, and that's some more information about me. I'm not going to be reading each of the slides completely today. I'm going to be covering the high points so that we can make sure we get all this information covered in the amount of time allotted. The first few slides that I'm going to be covering have to do with the ADA and the duty to effectively communicate. Of course, as an Assistant Attorney General, all the information I provide today is non-binding. And we're covering a lot of information in fairly good detail. This is still the Ultra Reader's Digest version. There's two main points to remember. A public entity is required to ensure that any entity with whom it contracts meets Americans with Disabilities Act requirements. So make sure any entity that you contract with, particularly provide training, meets of these effective communication requirements. And also, a public entity or private business has a duty to communicate or provide effective communication with members of the public who receive its services. And of course, as a lawyer, this is a pretty good outline of what we're going to try to cover in today's presentation. The first part is going to be about the legal requirements, which I'm going to hit in a very overview kind of pattern. Then, of course, we're going to have the effective communication requirements that I've mentioned a little bit right now, and then more detail later. And then the effective communication policy. We have a model policy that we have put together that is a good for any entity listening to this broadcast may want to implement one for their entity. And of course, we're going to talk about a good bit about auxiliary aid services. Renee has mentioned the fact that we're going to be having demonstration of several auxiliary aids and services. Then also, we're going to talk about the effective communication toolkit at the end. We put together a resource for anybody listening to this presentation. And then, of course, if time allows, we're going to give you an opportunity to apply the information that you've learned today to actual scenarios. And if time runs out, I'll briefly describe those scenarios. Again, as I've mentioned, I'm going to cover the high points of communications access for individuals who are deaf or hearing impaired, those who are blind or visually impaired, and those with cognitive or intellectual impairments and speech impairments. And if you have any questions, you can call me in the future. I have a toll-free hotline, 800-205-9986 or 888-574-2257-TTY. Disability-specific laws. All of the information we're talking about today is required because of one of these laws. The Americans with Disabilities Act of 1990, the ADA Amendments Act of 2008, or the Rehabilitation Act, Section 504. And of course, you know, the Rehabilitation Act applies to entities that receive some type of federal financial assistance. In the ADA perspective, what I call the ADA perspective, these are the types of entities are typically have a duty to effectively communicate. Of course, government agencies, cities and counties, doctors' offices, lawyers' offices, courthouses, grocery stores, private employers. More in the ADA perspective requires not just physical access, but also changes in policies and communications access. The reason we mention this, a lot of people understand wider doorways and ramps and accessible bathrooms. Many times the duty to effectively communicate is not as well or widely known. Overview, these are the central principles of the Americans with Disabilities Act, mainstream. In order to fully include people, we need to include effective communication. Equal opportunity to participate would also have a duty in itself to provide effective communication. People don't receive information in correct formats or in a format that they can understand. The opportunity to participate is greatly affected. And of course, access, I mentioned a minute ago in the overview, also includes communications access, not just physical access. And as a civil rights law, the Americans with Disabilities Act attempts to improve full access for people with disabilities. And the good news is we're not going over each of these 5 titles, but when we talk about employment, that's part of the ADA that requires equal opportunity employment. Title II, public entities, these are state and local governmental entities, cities and counties that are covered by the ADA and have a duty to effectively communicate. Of course, Title III, public accommodations, this is really private businesses that will also have a duty to effectively communicate. Title IV, telecommunications, we'll not really be covering that today, and Title V, miscellaneous. The next slide, associative discrimination. This is where the impact of effective communication is even larger than just the individuals who directly receive services. It also could be individuals who associate with persons with disabilities. The associative discrimination provisions of the ADA prohibit discrimination against those who associate, like family members, spouses, business partners, etc. It also applies to family members, associates who suffer because of lack of communication access. If my parent came with me to a doctor's appointment, even though I didn't have a disability that affected communication access, if my parent were deaf, that parent would have a right to effective communication when I went to the doctor, and the doctor was explaining my course of treatment and the side effects of that possible course of treatment. Effective communication, next slide. Again, as we stated, imposes a duty on those entities, state, local government, private employers, private businesses, to provide effective communication. And extends, this duty to provide effective communication extends not only to applicants for jobs and benefits, but also employees and hospital patients and other parties. And effective communication, the more complex communication becomes, and we're going to have an individual interpreter and a person who has a deaf technology specialist talk about, you know, the more complex communication is, more likely one will need an interpreter. And it's also advisable, sorry, wrong slide. And also it's also advisable to use an interpreter, sorry, excuse me, I'm getting on the right slide here, to ensure precise communication in a situation where miscommunication could lead to liability for damages. All right, the next slide. Effective communication particularly becomes important when you have a very complex clause in a contract, in a binding agreement, making sure an individual understands. Also, a job assignment that could impact the health or safety of others where specific detailed instructions are necessary. And here's the part where I'm going to not cover the detail of each slide, but these are the regulations under Titles 2 and 3. And you will note after you read through these slides that the regulations impose very similar requirements. And we have the actual regulation itself. You notice in this slide 35.160 in the Code of Federal Regulations. This poses the duty on a public entity to ensure effective communication with applicants, participants, and members of the public, and companions of those with disabilities. And then more in the Title II regulation, this defines what a companion is, anywhere from a family member or friend or associate of an individual seeking access. And then the other regulation, public entity, this says shall furnish appropriate auxiliary aid services. So the duty to provide is a very strong one. And the type of auxiliary aid service will vary depending on the situation. You know, one size does not fit all as we're dealing with folks. People with different types of disabilities that affect communication will have different needs. So this regulation talks about the type of auxiliary aid service that will be required depends on the nature, length, and complexity of the communication and the context in which the communication is taking place. And there's also primary consideration. We're going to talk about this more in a later slide, but a public entity such as state or local government should give primary consideration to the type of auxiliary aid or service requested by an individual with a disability. This next slide talks about accessible formats and providing them in a timely manner and in such a way to protect privacy and independence of the individual with a disability. And the next slide talks more about a public entity's duties. This information will be put into the toolkit that we'll talk about at the end. And then in emergency situations where there's an imminent threat to the health or safety of others, there are certain exceptions when there's no interpreter available. When there's no interpreter available, and where the individual specifically requests the adult accompany with them or a family member to interpret, that can be an exception where that person can be used to facilitate effective communication. And then a minor child usually cannot be used to interpret for somebody, but in emergency circumstances where there's an imminent risk of harm or threat, that minor child can be used. And that's what this regulation section discusses. And then the Title III regulation, as I stated before, I will not be covering these in detail. They mirror the Title II regulations. Once you have this information. And as I like to say, as I go through these slides, you can take this information in subliminally at this time, then afterwards you can read it more detailed after this presentation. And then this next slide talks in more detail about the different types of auxiliary aids and services that are detailed in the regulations. And we're going to be talking about most of these auxiliary aids and services today. And again, there's another slide with more listing of the different types of auxiliary aids and services. And the same with the next slide, starting out with captioned telephones. And then the next slide talks about different ones for folks who are blind, different types, from qualified readers and take text all the way down to large print materials. And again, the last part of those regulations under Title III talk about different types of methods for making the information accessible. And then the next slides talk about the exceptions when you can provide something other than interpreter. And again, these mirror the ones I just discussed under Title II. All right, going through these very quickly, give you a chance to read these, but these will be available to you later in the toolkit. We have a lot of information here, certainly. All right. Telecommunications. And again, talks about some of the particular types of auxiliary aid services that are available to persons who are deaf. Again, other slides. The next slide does the same thing, and the last slide, under the regulations, under that part, it talks about more auxiliary aid services for folks who are deaf. And the next slide, I want to mention a public accommodation may use relay services in the place of direct telephone communication or receiving or making telephone calls, incidents, operations. Many people today don't use the relay system. They use video relay services, and we'll have a chance today to talk a little bit about the video relay services. Again, more information about use of a TTY. Okay, and the next slide talks about closed caption decoders, which are another way of making information accessible to folks who are deaf or hearing impaired. And then we'll be talking a little bit today about video remote interpreting services, which are often used when you're not able to get an interpreter on site, but you can access an interpreter from a remote area. Again, more information about different types of auxiliary aid services, and about video remote interpreting, about how clearly the individual interpreter should be displayed on the video. And then the last part, and then adequate training so that people can operate the equipment correctly. And then, of course, we're going to talk about what happens if one type of auxiliary aid service is not available, other alternatives. The regulations allow use of other alternatives to provide effective communication. And that's what this part of the regulation discusses. We just wanted you to see the regulations in play here so that you don't take our word for it. I think you should take our word for it, but we want you to see this in writing too, to give you kind of a preview of what will be in the toolkit. Again, that's more the Title III regulations mirror the exceptions that are displayed in the Title II regulations. All right. The next part we want to discover real quickly is the effective communication policy. We have a model policy in place, and I want to just talk very quickly about the different parts. And we have, this has been posted, and I don't know if this can be displayed now, but we have a policy for ensuring effective communication of individual disabilities. We talk about the purpose. In every policy, the beginning paragraph should be about why the policy has been created. And then, of course, the prohibition of exclusion. That's what every policy, when you're trying to use effective communication, of course, it's to prevent people from being excluded. And, of course, the definition of auxiliary aids and services, a lot of people in a policy that say, what are auxiliary aids and services? So having this clearly set out in a policy is very important. And then the definition of a qualified interpreter. We're going to have some of our folks today talk about interpreters, but not every interpreter that is certified will be qualified for a particular situation. And then, of course, when to contact an interpreter. If somebody in your entity that you have a policy for doesn't know when to contact an interpreter, this could lead to a lack of effective communication. And then we're going to talk about in future slides about surcharges and what they are. But this policy has a prohibition of surcharges very clearly stated. And the policy also, besides those components I just showed on the previous slide, the policy also has procedures for requesting auxiliary aid services. How do you go about requesting an interpreter? Who do you contact? How do you go about requesting different pieces of equipment? Who will have those? And then alternative formats. Where do you get Braille? Where do you get large print? And then, of course, records keeping and staff training. There's a request form that's also a part of this policy that you're given access to for an individual to request different types of auxiliary aids and services. And of course, in case you're wondering, this is the definition of auxiliary aid services. You saw this in my very quick overview of the regulations. And again, it includes qualified interpreters, video remote interpreting, note takers, real-time transcription, written materials, exchange of written notes, telephone handset amplifiers, assistive listening devices. And again, here's some other examples of auxiliary aid services that we're going to be demonstrating today. And again, just more examples of auxiliary aid services. So we have, and again, the auxiliary aid services that mirror what's in the regulations for folks who are blind, qualified readers, tape text, audio recordings, Braille materials, and others. Again, that's more information on auxiliary aid services in the next slide, which we're going to be discussing through our content experts. And the last, video remote interpreting, and this is where I talked about a service where you can access an interpreter from another state or within a location outside of where you are, where you're not able to obtain an interpreter right on site. And again, a video remote interpreter has to deliver high quality video that doesn't produce lags or choppy, blurry, or grainy images or irregular pauses in communication. It has to be the same as if, very similar to if you had a live interpreter there with you.
So, Graham, would this be something like FaceTime?
Yes.
Something along those lines?
It could be FaceTime. In fact, some people have used FaceTime. It would almost be like Skyping an interpreter on a laptop. But a lot of people will use FaceTime locally or within the state. I've heard people using FaceTime to access an interpreter. Yes, very good. And again, just this is more information in the next slide about VRI, more detail. And again, more information on video remote interpreting. And again, another detailed slide on communications access. Where necessary to facilitate effective communication, a covered entity under the ADA, such as an employer, a government agency, or private business, may be required to provide Braille documents. You've seen those in the regulations, large print documents. And then also some of the other auxiliary, a reader, mentioned interpreter already, assistive listening system, and that's where, for people who are hard of hearing, if somebody can speak into a microphone, it transmits what somebody's saying in a microphone directly to an earphone in somebody's ear, and it's greatly amplified. And then closed captioning, you notice on your TV set where it has written information, it has a text of what somebody's saying on the video. Real-time captioning is what we call CART services, where when somebody's saying something, a stenographer prints out what they say on a big screen, so people cannot get an actual, word by word what somebody's saying. And then qualified interpreter, this is information that our interpreter expert is going to be covering. And again, in a qualified interpreter, next slide, it's going to be different for a courtroom and a legal situation versus a medical situation. You're going to have interpreters that have different expertise. I imagine one interpreter is not going to have the same expertise in all areas. And this thing about no interpreter on demand, you should have notices of meetings saying that if you need an interpreter, here's who to contact. We need so many. A lot of places say we need 10 days, at least 10 days. In our interpreter policy, we have a 10-day notice to request an interpreter because there's a shortage of interpreters in our state. So in the next slide is more information on no interpreter or demand. But an employer or other entity may be required to anticipate the need for an interpreter. So if you have a meeting that's generally open to the public and it's anticipated that people with those type of impairments will need it, then you should plan on getting an interpreter, or at least have a standby or plan for obtaining one. And again, interpreter access for the job, all the way from the application process to the interview, discussion of job benefits. I have a scenario at the end where somebody had missed out on retirement because they didn't have an interpreter available, and then other conditions in terms of employment. And again, particularly in a doctor's office, the cost of interpreters should not be borne by an individual with a disability. That's what we talk when we talk about a surcharge. The cost of interpreters should be absorbed by the doctor. And then we have something with a community civic organization, a deaf individual who wished to attend a business seminar. The interpreting service requires always provide payment in full prior to the seminar. That should not be borne by the individual with a disability. And then due to a business emergency on the next slide, the individual may not be able to attend the seminar where they've requested an interpreter. The individual is still not going to be liable for the cost of the interpreter. And then surcharge, basically an individual with a disability cannot be charged the cost of an auxiliary aid or services. Some entities, instead of charging the individuals, may pass a proportional share of the cost to all their customers, kind of like an overhead charge. All right. And I mentioned at the beginning about training contracts, making sure that if you have a training contract with an outside entity, making sure that entity provides effective communication. Like, who will be responsible for providing the interpreter, the large print, or the Braille? Employer cannot contract away ADA responsibilities, so if you're an employer trying to comply with this section, you need to make sure entity with whom you contract, including trainers, comply with the duty to effectively communicate. This next one, what if an deaf individual comes by to pick up an application for employment? Would an interpreter be required? Probably not. It's just a simple transaction. What if an application process are oral responses to in-depth questions? Would that make a difference? Absolutely. The more complex the transaction is, more likely an interpreter is going to be required. And then information as a promise and primary consideration doctrine for public entity. It doesn't mean that the entity can't consider other alternatives if one type of auxiliary service poses an undue hardship or fundamentally alters or changes the nature of the program. In personal devices and services, an entity is not required to provide hearing aids or other individually prescribed devices to somebody with a disability. In personal devices and services, not meant to be interpreted to include minor assistance. An example given is a nursing home or hospital that customarily provides its clients with what might consider service of personal nature. It must provide the same services for individuals with disabilities. Holding the door open for somebody, picking up something that somebody dropped. Those might be examples of things that are not considered personal devices or services. All right. We have our next presenter. I wanted to introduce her very quickly. Her name is Miss Wendy Darling. She is a certified interpreter, and I'll let her add anything else that I may have forgot to mention. She is going to be covering these areas that we have on the screen right now.
As Graham said, my name is Wendy Darling. I work for the Department of Rehabilitation Services, and I'm the State Coordinator of Interpreter Services. I'll talk to you a little bit about sign language etiquette, how to secure an interpreter, that the Alabama Board of Interpreters and Transliterators has a licensure law for interpreters in Alabama. First of all, sign language etiquette. When you have someone who is deaf or hard of hearing, someone who uses sign language coming into your office and you know that you need an interpreter, what you would need to do is call the local deaf services agency. You would have to check in your phone book because they're different all over. If this is just in Alabama, the first place I would go to would be Alabama Institute for Deaf and Blind. They have 8 regional centers across the state, so it would be fairly easy to find one in your area. You could go to aidb.org and look for their regional centers. When you get the interpreter and the deaf person comes with you, sign language etiquette is very important to look at the person you're talking to, not the interpreter, but the person who's actually applying for the job, or the person you're serving is the deaf person, not the interpreter. It's very awkward, I know, to hear someone's voice coming from behind you, but you're looking at someone else. I do realize how awkward that can be, but remember the person you're serving is the person who is deaf, not the interpreter. If they're having any trouble with that, then the interpreter would likely remind you to look at the person, speak directly to them. Avoid phrases such as tell them or ask them or can you tell me how old they are? Do you know their name? Those kinds of questions. That's very disempowering and very disrespectful if you just stop and think about it. Most people don't, and they don't mean anything by it, but it happens quite often. Now, to make sure that you have a qualified interpreter, as Graham mentioned about the ADA mentions that you have to have a qualified interpreter. Just because someone is certified or licensed doesn't necessarily make them qualified for every job. He also mentioned that there are specialty areas like medical, legal, educational, mental health. There are a lot of different specialty areas that someone can have on top of their regular certification. If you get a licensed interpreter in Alabama, you're typically going to get someone who's qualified for most of those areas, except for probably some legal instances. But there is the Alabama Office of Courts has a list of interpreters who are allowed and approved to be interpreters in the court system in Alabama. So you can go to their website and find that information and get a list of interpreters, where they're located, and contact information. Now, to find out if someone is a qualified interpreter, you would need to check with the interpreter themselves, ask for a copy of their license or their permit. There are 2 levels for interpreters. If you want to do that ahead of time, you can also look at the Alabama Board of Interpreters and Transliterators website and check to see, they have a roster of permitted interpreters and licensed interpreters, and then you can find their name on the roster and when their license or permit expires, so you'll know if they are still allowed to interpret in Alabama for money. Now, when I say for money, I mean a professional interpreter, but also you can't hire someone, like if Public Health wanted to hire someone to be an interpreter, even if they changed the title of their job, but their primary duties were interpreting, they still have to have a license or a permit. It doesn't matter what your job title is. It's the primary duties of the job. If the primary duties are interpreting, then you'd have to have a license or a permit. But it's very important to make sure that you have someone with a license or a permit, unless they're volunteering. If you're having a health fair and you want to provide an interpreter and you know someone who knows someone and they're willing to volunteer for the day, that's okay. But just know that if it's anything that's complicated, anything that's, you have to sign anything that's binding, it's very important to get a qualified interpreter.
All right. Is there, and I know that is there anything in particular, Wendy, that you like to demonstrate about interpreting? You mentioned about looking at the person directly and making sure that, and then making sure you don't use certain phrases. Is there anything else about interpreting that that somebody should know about that may not otherwise be aware of some of the complexities?
I believe probably seating in the environment, nothing visually distracting. The lighting needs to be appropriate. The type of clothing the interpreter wears would be something like what I'm wearing today, which gives a good background for my hands to be seen. It's on the slide that says demonstration of interpreting, but as you can see, Josh is interpreting right now.
Yes.
But I wanted to make sure that even though you may have the interpreter there, but there may be a time when someone's in a waiting room or somewhere before an interpreter gets there and is able to listen out for that person's name to be called. You want to make things that are generally auditory, make them visual. The scrolling signs are great. When you call someone's name or give them a number, make sure there's a number. Someone posts a number up there so they know when they're being called. A lot of times I've heard stories of people sitting in waiting rooms for a very long time because they didn't know their name had been called. So, and they end up being at a doctor's office for 2 or 3 hours waiting because they just had no idea that their name had been called. So if you could make things that are generally auditory, make them visual, that would really help a lot. Also, when you mentioned about the telecommunications part of the ADA, if you have a television on in the lobby or wherever, make sure that the captions are on. I noticed a lot of people are doing that nowadays, whether they expect anyone deaf or hard of hearing in the audience or not, but because it really helps everyone.
That's great. Thank you, Wendy. That's perfect information. Excellent. Thank you. Right now we have another content expert, Mr. Jason Martin, and Jason is a blind technology expert. And I'll allow him to say anything else about his expertise that I may have left out.
Thanks, Graham.
And he's going to be providing a demonstration and discussion of the items posted on the screen right now.
So there are a number of assistive technology devices that work for visually impaired individuals. And an assistive technology device really can be anything as simple as a writing utensil, or it can be as complex as a whole computer program. And so kind of for today's presentation, I wanted to show some examples of how an individual with total sight loss, or that is considered totally blind, uses Braille. And I've got on our desk up front, actually, a Perkins Braille writer, which is the more traditional way of writing Braille. It looks like an old-fashioned typewriter, if you will, and it works with 6 keys and Braille paper inside it. It is the most fundamental, really, way of producing Braille. And Braille, again, is a code of 6 dots. And each key represents 1 dot in Braille. And so that's kind of the more old-fashioned way of doing Braille. It's a tried and true traditional way to do it. Next to that, I have a little bit more of a high-tech option. We call these a Refreshable Braille display. And what it is it takes the same 6-key entry that a person would have learned using the old-fashioned Braille writer, and it allows that person to do what we call digital Braille. So using this device, they can feel the dots change. They pop up and lower down as the information changes or as the text changes. And that information can be manipulated with the 6 keys. That can combine with a computer or an iPhone and allow a person to actually work within a Braille environment through multiple different computer programs. And those are kind of the ways of receiving Braille. And right next to that as well, I brought, and it might be a little bit difficult to see, but I brought an actual printout of Braille. And if you would open it up to maybe a middle page, you can see a little bit more Braille inside it. Again, visually it's a little hard to read because it's just a series of dots that the users read with their fingers. So moving away from more Braille-oriented ways to access information, we go to a more computer setting. And I brought my computer here today, and if you will, just listen auditorially to hear what kind of is displayed. So a blind user uses a program called JAWS or another screen reading program. There are various screen readers. Personally, on this computer, I have JAWS, which is Job Access with Speech. It allows a blind person to only use the keyboard to access information on the computer. So, for instance, if I hit the Start button,
menu, search box, edit, type text in this edit field or press up or down arrow to move through items.
Tells me a lot of different things. Menu, press button to manipulate through the item. So I press the Start button. I might manipulate the computer with the up and down arrow keys.
Leaving menus, folder view, list view, VNC view or sub-menu, 1 Word 2013 sub-menu, 11,
I'm simply arrowing down through what JAWS is telling me.
JAWS 16.0, 4.
Now, the entire computer can be manipulated. Some different types of programs are not the easiest, and what I would say, they're not the most accessible. And so when people are building computer programs, generally we want them to be what's called universally designed so that they work with programs like this. Not everything works, not every website works with a screen reader like this, But the majority of programs that you use, everything in an office environment, in Windows and Microsoft, should be accessible for a person going to work. And generally, you can do this without using any vision. And if you have a hearing loss on top of a vision loss, that's when we combine this program with the Refreshable Braille display so that we can feel and listen to anything, any bit of information that's electronic and comes out. Now, I also brought a CCTV, which helps kind of magnify information for people who have low vision. And it's quite an amazing contraption. Essentially, it's just a computer monitor with a camera that magnifies on the top. So, in a number of different cases, a student could find or a person could have information brought to them that they can't see readily, or it's not extremely big. So a lot of low vision users use large print text. Now, that's not just a trivial term. Large print text is generally 16-point font, and it can be in Calibri or Times New Roman, you see it, or there's a font produced by the American Printing House for the Blind called APH font, or A font for short, which is kind of the global standard for accessible large print font. But say if it's not produced in large print, say if it's not the best thing in the world to see. What's nice about having a CCTV is that you can increase magnification, and I've got a business card underneath this, so we can zoom in to make the business card font, which is generally pretty tiny, we can zoom in to make this absolutely large and that you can read it with great clarity. So a person that is using or needing large text for, say, 15 minutes, this might not be the best fit. A regular magnifier would work just as fine. But if you're a person that's going and working in an office for 8 hours a day, that eye strain can be a lot. And over time, this actually curbs that eye strain so that the person's not having to stress and read in deep detail. So it's quite an amazing thing. And a lot of people use these CCTVs to actually, you can flip the camera to look at your face. You can do your makeup if you're a lady in that sense. Or if you're a student listening in a classroom, the camera can be flipped to go and read the blackboard, which is pretty astonishing. And I would be amiss if I didn't mention the beauty of the iPhone. The iPhone is quite possibly one of the most accessible devices on the planet for a person who's visually impaired. It's not the easiest thing to use. However, it does come with a built-in screen reader, somewhat similar to JAWS that I showed you on a computer, but it's a more portable aspect and portable way of using this technology. One of the most useful features that I found with an iPhone and for a person with visual impairment is identifying money. Sometimes you have to go based on solely the word of someone. Is this a $1 bill? Is this a $5 bill? Is this a $10 bill? Well, with the iPhone, one thing that's nice is a lot of apps for people with visual impairments are becoming cheaper and they're becoming faster. So traditionally, where this would have cost maybe $100 to have a money identifier, the app is called Looktel Money Identifier, and it only costs about $10, and it allows a person to know what type of currency they have. For instance,
$1, $1, $1.
If this was a 5, if this was 100, it worked fairly quickly. This was technology that was absolutely groundbreaking when it came out, and it still is if you have a vision loss.
All right. And here's some pictures that we have in the next slide of some of the different devices that, you know, he demonstrated: the CCTV, the Braille equipment, the Braille document. And one thing he didn't mention about Braille is that sometimes if something is Braille, it's going to take up a lot more space. You know, your typical, you know, large document could be a very thick Braille document, and sometimes storage of Braille can be an issue. So, and is there other ways to transmit information, Jason? Like some people have PDF form requests that they request a lot of documents in PDF, and a lot of screen readers will read PDF. Is that correct?
PDFs work fairly well if they were prepared correctly, which they have to be pretty much a searchable PDF. But like you said, Graham, for every print page that you have, Braille is roughly 2 pages. And the cost of Braille is not the lowest. And so when you have a 30-page book, that turns into a 60-page Braille book. So, and like you said, it's very, very large and cumbersome sometimes to store this.
And do they have portable screen readers and CCTV? You mentioned the one on the iPhone. So would a large print document be better than having somebody use a screen reader, or what?
Depending on the setting. If you're in a more private setting and you're looking for a way to have information sent to you, then the iPhone is absolutely perfect. But now the iPhone doesn't work for everyone. So there are other brands of magnification, like basically handheld magnifiers. Now screen readers get a little bit tricky when you go portable. Honestly, you can't find a better portable screen reader than the iPhone at this point. But there are some other options like TalkBack, which works for Android, and just a different version of JAWS, or a free version for anyone called NVDA, which is a free screen reader. It's fantastic. It's just sometimes you may be in a setting like, say, we are right now, and it's not really the right place to sit and listen to a screen reader. Or say you're listening to someone present, sometimes that's when it is good to have large print, or it is good to have Braille, so that you're not really disrupting the environment with a screen reader.
Excellent point, Jason. Thank you for clarifying that. And also we have some other equipment, talking pill bottles, which are, the pharmacy has to participate in that program, but that enables a lot of people to get a lot of very detailed information very quickly. And so thank you very much, Jason. And we have Mr. Carl Wade next. He's going to, and Carl is a good friend of mine. He is a retired state trooper, and very, very knowledgeable, and he's going to demonstrate for us some etiquette on helping folks who are blind, and also demonstrating use of a cane.
Here you are, Carl. And we're back.
Well, what I just demonstrated was use of a standard long cane. That's what this is. It's been around since the late 40s, and it's a very useful tool in helping people who are visually impaired or blind navigate and independently navigate. What I have in my hand right here is a collapsible cane. Same thing, serves the same purpose. It's just easier for me to use, because when it's not in use, it's easier to store, and it doesn't get in the way. And sometimes this cane gets in the way. What I'm mainly going to talk about right now for the next little bit is what I call blind etiquette, and it's the do's and don'ts. I'm going to lead up. First off, treat people. People who are blind are people first. Our disability does not, and impairment does not define us. It's what's in here that defines us. So treat us like people first. When you are talking with a person who is blind, first off, don't raise your voice. By you raising your voice is not going to help me see you at all any better. So you don't have to raise your voice. Talk in a normal tone. Also, when you're approaching a person who is blind, identify yourself, or let us know that you're there. It is very disconcerting and sometimes unnerving to have someone all of a sudden appear in front of you and speak. So all you have to, or to touch you on the shoulder or the arm. If you when you're a few feet away, just identify yourself. Hello, I'm here. It lets me know that you're there. Also, if you're talking with a person who is blind, don't ask them to guess who you are. Identify who you are by the tone of your voice or by the sound of your voice. A lot of people have very distinctive voices. A lot of people don't. A lot of people have what I call everybody's voice. And it's embarrassing and it's frustrating when I can't guess who you are by the sound of your voice. So introduce yourself. Walk up and introduce yourself. If you see someone who is visually impaired or blind, and they're walking down the street or something like that, and it looks like that they're going to, there's an obstacle in their way, walk up and certainly advise them of that. Advise them. And offer to guide them around the obstacle or the rough area or whatever it is in their path. Don't do what I call insist upon being of assistance. Don't just walk up and grab a hold of a visually impaired person's arm or a blind person's arm and drag them around the obstacle. That's again, that's another thing that's very unnerving. Always ask if you can be of assistance. Don't be offended if the person declines your assistance. It doesn't mean that they don't appreciate the offer. It just means that they don't need the assistance right then. But they do appreciate it. I appreciate it when someone offers assistance to me. But don't insist upon being of assistance. When you're talking or having a conversation with a person who's blind, don't walk off in the middle of the conversation without letting the blind person know that you're leaving, or don't walk off. It's awfully embarrassing to be standing there talking to yourself, thinking that you're talking with someone and they've already walked off and left you. If you are being a sighted guide for a person who is blind, don't grab the cane. If I'm using the cane, don't grab the cane or grab me by the hand or the arm or the shoulder and drag or push or guide me around that way. That's not the way to do it. The proper way to do it, there's two ways to do it. One is let the person who is blind take you by the elbow. And either side works, either right or left side, whichever one is most comfortable for both of you. The person who's being guided will walk to your side and a half a step back, and then you'll proceed down the way. If you come to a set of stairs or a curb or something along those lines, let the blind person know that you're approaching stairs or a curb, either up or down, and pause at the edge of those stairs and let the person who's being guided orient themselves to the stairs. And then as you saw Jason do, or you may not have, but anyway, he paused at the edge of the stage and allowed me to orient myself at the edge of the stage, and then I stepped up and proceeded. Communicate. The more information I have, the better off I am when I'm walking along. If you come upon a person who is using a guide dog, do not, under any circumstances, touch the dog, pet the dog, distract the dog, feed the dog. Don't touch the dog. The dog, when it's in harness, is a service animal. It's a working dog. And if you distract the dog, then not only do you cause the person who's using the dog to lose control of the dog, and you also put them in jeopardy, because the blind person that's using that dog is putting their safety and their well-being in that dog. So if you're a dog lover, and a lot of people out there are, approach the person, the guide dog user, and ask if it's all right to pet the dog or make over the dog or whatever. And most guide dog users will allow that. They usually take the dog out of harness, and once the dog gets out of harness, then it's a dog again, and so you can treat it like a dog. But while it's in harness, it's working, so don't mess with the dog. I went over these, and last, well, there's a couple more things. One is if you're with a person with who is blind or visually impaired, don't talk for that person. As Wendy said before, it's very easy for people out there to talk to a blind person's companion and ask, well, especially in restaurants and cashier situations, what does he want to order? How would he like to pay for this? I can talk. That's obvious. Talk to the person and address all your questions to the person who's blind. That's just common sense. In closing, I want to go back to the first thing that I said. Treat people who are blind or visually impaired as people first. When you accommodate our special needs and the few special needs that we need or that we have to have, you allow us to function and be productive and contributing and independent members of the society. Thank you.
Thank you, Carl. And I think it's very important, too, is what Carl's saying about communicating. He mentioned stairs and curbs, but also other hazards like power cords, or if there's holes in the sidewalk, or there's some type of danger, make sure you communicate that, too. That's very important. And we have a few other slides. We're about to take a break. We have a slide about iPhone accessibility, and Jason Martin talked about that some, and then we got more information on the reading apps, and then also he mentioned about the money identifier, which is very important. And next thing after break, we're going to be talking about some of the technology for deaf persons. So thank you very much for your attention at this point. We take a short break at this moment.
And if you have questions, I want to remind our viewers that you can go ahead and email those in, or you can call them in. The number is on your screen. Thank you. Thank you for joining us again for the second part of our program. Graham, we've covered a lot of really good information so far, but I know we have quite a bit more to go.
Absolutely. All right. Welcome back. We have our next presenter is Daniel Lute. Daniel is a deaf technology specialist, and he himself is deaf, and he is going to be sharing a lot of information with us now. You can notice the slide, some of the information. I talked about video remote interpreting, text telephones, video phones, Ubi Duo, assistive listening devices, closed captioning, some other areas. So I will turn it over to Daniel at this point.
Great. Hello. Just like Graham said, my name is Daniel, and I'm going to be giving doing some demonstrations and showing some types of equipment that are helpful to deaf individuals. What I've got here is basically a video phone. We can also call it VRI. It can be used in a VRI situation. This is a standalone device. A lot of times nowadays you have a camera that's placed on top of the TV, or you might have a smartphone that can do the same job. But the point of it is, myself as a person that uses sign, I would use the camera and the image will go to an interpreter that may also communicate what I'm saying to a hearing person. So basically, I can use my native language instead of having to use English. So that's a benefit for the deaf community. It's a great device. I want to show you kind of some older technology. This is a TTY. Some people call them a TDD. It's pretty old. Not many people are still using these devices, but it was great back when it came out. Basically, you have a keyboard, and you can see the message that you're typing out. You take the analog or digital phone if you have a connection, and basically this is text-based, and it's not really, like I said earlier, it's not really my native language. So, and also, keep in mind, the video relay, the video phone has to have a high-speed internet connection. So having a TTY or TDD out in rural areas might be good. So you can actually also, you can use this as a relay device. You can have an operator in the middle. It's kind of a slow process, slower than when compared to the video phone, but for some people that's all they have. And so now I've got a couple of devices. I know most people are familiar with smartphones nowadays, using either the iOS or Android operating systems. You've got so many different apps that could be used, like someone talked about earlier, FaceTime, Skype, different companies, video phone companies like Sorensen is one of them. They have apps that go along with their features and their program that you can actually access. Something else is an app called Buzz Cards is used when a person might go to a restaurant. A deaf person may want to just have a text-based communication. I don't want to give my phone to someone, even though I might type out a message for them to read, so I can enlarge the print so I don't have to give it to them. Also, there are a few programs that are in beta that do real-time speech to text. For example, a lot of hearing folks use Siri or Google Voice or whatnot. You can basically record your voice and it will turn it into text. One program called Ava that's in beta testing is trying to do that for the deaf community. That's upcoming technology. Something else, like I mentioned a minute ago, Google Voice. It's pretty awesome. It's great for hard of hearing or deaf individuals. They can use their own device and also connect. Have an account. It's a free service, and then a hearing person can call and leave a message. I don't have voicemail, but if I had that service I'm talking about, I could receive voicemails and have them converted to text so that I can read a voicemail that someone left me. Something else is pretty cool. It's an app called Roger Voice, and it's pretty new. It's pretty much the same concept as Ava, the one that I mentioned earlier. It's a real-time speech-to-text, but Roger Voice is device-based. It doesn't use a remote or a different setting. It basically does all the figuring with the device that you own. Again, like I said, there's so many different apps that have been developed, purposely for access. If you've got any questions, I work for the Alabama Department of Rehab Services, and I'd be happy to help communication needs based on an individual and what they need. Thank you.
All right, Daniel, just one point, one information I wanted to ask you. It's on the next slide that we have here. For people who are both deaf and blind, there's something called support service provider. Can you describe what a support service provider does for somebody that has both those disabilities?
Sure. Right. So no problem. We basically, you said support service provider. We call those SSPs. The goal is basically to make an environment accessible to a deaf-blind person. They can also be used as a guide. They can, like for example, if a deaf-blind person was, wanting to know what was going on in the environment, like if the audience was laughing or things like that, environmental cues. SSP can use something called ProTactile, and it's pretty interesting. It's basically haptic, a couple different ways. An SSP can use a series of touches on the back of the deafblind individual to help cue them in on what's going on in the environment, as well as being a guide. It's a little bit different. SSP is not what we call an interpreter. You'd have another person doing the tactile interpreting, but so they do differ a little bit. They have specialized jobs, and it is an interesting thing. I hope that answered your question.
Yes, very good. And when you say tactile interpreting, is that where they interpret into somebody's palm of somebody's hand? Could you kind of demonstrate that, or?
Right, sure. Sure. All right, so suppose that Josh was the deafblind person and I'm the interpreter. Basically, we would have a situation like this. I could sign normally, but his hands would be on top of my hands, and I would do like this. Hello, my name is Daniel, and this is how the deafblind person would get the information. Basically, what I would say is accessible to that person.
Thank you. I just wanted them to demonstrate somebody who had never seen somebody interpreting for a deafblind person. Thank you very much.
Sure. You're welcome.
All right, and here's these other slides. This is some of the equipment that was demonstrated. There's one more question. We have a picture of a Ubi Duo. Could you mention, Daniel, describe how an Ubi Duo works?
Sure. Yeah, no problem. So the Ubi Duo is basically, it's got two components of the device. One part of it is, it takes two people, basically. A person can stand and input some information with the keyboard, and then another person nearby, suppose you couldn't have an interpreter on the spot, but you do need to have communication right away. It's a little bit better than writing on a piece of paper, or maybe you don't have any paper. I mean, you can use this device to give a message to like a receptionist or something. But of course, different people have different skills as far as keyboards and typing. And also you have to remember that this is not in their native language. It's not the primary, it's not the ideal, but it's something that can take the place of an interpreter if you don't have one for a short time.
So with the Ubi Duo, you basically have two keyboards and you have two screens. And one person types the message to another person, the other person types it back, that generally,
exactly.
They can see it on the screen. Okay.
Right, exactly. You could see it in real time. You don't have to take turns. You don't have to, while I'm typing, the other person has the text, appear on their screen in real time.
So it's almost like texting between phones.
Right. Well, the idea of it is similar to that, but when you're texting, you've got to wait until I'm done, and then I hand it to you, and you can read it. It takes a little time. You see what I type in real time with the Ubi Duo, but the idea is the same.
Okay. Thank you.
All right. Thank you. Thank you.
You're welcome.
Thank you very much. Now I would like to call on Mr. George Neal. George is an advocate for people with intellectual disabilities, and he's going to talk a little bit about person-first language and etiquette for people with intellectual disabilities or cognitive disabilities. Turn over to you, Mr. George Neal.
Thank you, Graham. Like Graham said, I'm George Neal, and I am the Director of the Office of Self-Advocacy Services for the Department of Mental Health. And I'll first go over some people-first language. The first one is you say he has a cognitive disability or diagnosis instead of he's mentally retarded. The second one is he has Down syndrome or a diagnosis of instead of he's Down's a marginaloid. The third one is she's learning disabled or has a diagnosis instead of she's learning disabled. The fourth one is he receives special ed services instead of he's in special ed. And the last one is children without disabilities instead of normal or healthy kids. Some of the etiquette is, like if a person with a disability has a companion that goes to the doctor, please talk directly to us because we're the ones that are getting the service instead of talking to the companion. And also, talk clearly, and don't use the big words like when you go to the doctor. This is from my personal thing when I've gone to the doctor. They use the big medical terms. Please talk in plain English and don't use the big words where we can understand.
We all would appreciate that.
Yes, we certainly do. And talk clearly, and don't turn your head when you talk to us, and don't hide your mouth with a piece of paper like this. Talk directly to us when you're talking to us. And if a person with a disability doesn't speak clearly, has a speech impediment, if you have a little bit of trouble understanding, please ask us to repeat it. Sometimes I have a tendency to mumble. Don't hesitate to ask me to repeat it so you understand. And lastly, please don't make decisions for us. Don't ever assume. Please ask, and we'd be more than happy to explain things to you depending on the situation. So we can make decisions for ourselves. Sometimes we need a little help, need a little more information to make those decisions, but we're capable of making decisions on our own. Thank you.
Thank you. And George, one thing I want to mention too, that if you have very complex instructions and there's a way to represent those instructions through the use of pictorial diagrams where it explains a complex process, would you agree with the use of pictures for some folks with intellectual disabilities?
Yes, I would.
Okay. Thank you. Thank you. All right. We have, this is Karen Baggett, who is a speech language pathologist, and she's going to explain some of the information related to helping folks with speech impairments.
Thanks, Graham. As Graham mentioned, I'm Karen Baggett. I am a speech-language pathologist with the Alabama Department of Rehabilitation. I work specifically for Children's Rehabilitation Service, but I do serve clients birth to 21 and beyond through ADRS. And I wanted to introduce today several devices that someone with complex communication needs might use, some of the technology that you may see with someone who has difficulty communicating. There are a lot of reasons why someone may have difficulty communicating. It can be due to a developmental disability such as autism or cerebral palsy or Down syndrome. It can also be due to an acquired condition such as a stroke or a traumatic brain injury. So you may see someone at all ages that may need to use technology to help them communicate with you. So I wanted to demonstrate a few of those today. We go from very basic equipment and technology all the way up to very high-tech equipment. Someone may simply have a piece of paper that may be laminated with picture symbols. They may have an alphabet board here that they can use to spell or even just indicate the first word of something that they need. You can have full messages and phrases with picture symbols that they may use. This would be particularly helpful for someone who's had some sort of acute issue where they may be in a hospital, they may be on a ventilator and have a trach, and they may not have a high-tech piece of equipment that they can use. So this is a really helpful way for someone who is able to understand picture symbols and spelling, that they can actually communicate with people using a no-tech solution for communication. There are some very basic low-tech pieces of equipment as well. They are not high cost. Typically these things cost less than $200, which may seem to be a little bit high cost. But as far as comparing these to very high-tech computer-type devices, these are pretty easily accessible for folks. This is called a Big Mac. This is a low-tech piece of communication equipment. This would be for a single message, such as,
Hello, my name is Karen.
let me turn that up a little bit.
Hello, my name is Karen.
So they may have this mounted to a wheelchair. They may, their caregiver may carry this for them, and when they go to greet someone, they can press this button. This has to be recorded. It's digital recording, so it has to be recorded by someone. Typically, it's best for someone who is of their same age and sex to program the voice for them. So hopefully, if it's a young child, you would have a young child's voice, or if it's an adult, you would have an adult program. And this can be changed very quickly in any setting, in any, to give them a voice for anything that they might need to speak. This is another example of this, and it's called a Little Mac. It's certainly much smaller. If someone has a significant physical impairment, they may need a larger target, such as the Big Mac switch. This one still is pretty big, but it's called a Little Mac, and this is the same principle. You can just record any message that you need.
Hello, how are you?
Okay. This one actually has different levels, and it's a step-by-step, so you can record multiple messages in. It could have kind of the turn-taking of a conversation. Hello, how are you? Then the other person may respond, and this one may say back, I'm good. Nice to see you again. So there can be a couple of messages programmed into something very simple such as this. Going beyond very low-tech equipment, you have something that I would call Midtech. These are a little more expensive, and they provide a little more as far as multiple messages. Someone can have single words programmed in, and they can put the words together to make full thoughts and sentences. They can also have full sentences programmed on one specific button. This is just an example of this. It's called a GoTalk 20. You can see that it has picture symbols. These are printed on paper overlays that have been laminated. This particular device has several levels so that you would be able to have overlays for a particular activity. So you may have one of these that has a whole list of foods or drinks on it so that if they go to a restaurant, they can order. Sorry, I'm having trouble getting this in there. So here's an example of something they might say.
I need help.
I can turn that up. Or they could build a sentence.
I want drink.
Okay. So again, this is digitally recorded. It needs to be recorded by someone, so there's a little bit that goes into making this and preparing this for someone who needs to use it. As you can see, these low-tech pieces of equipment, they don't offer a whole lot of language, so for someone who understands everything that's said to them, they're going to need equipment that's much higher tech than this. There are a lot of dedicated communication devices that are sold by companies. There's several companies out there that we typically use as vendors, and these companies are like Ford and Chevy. They're, you know, there's Print Keromic Company and Dynavox, so you may hear that terminology. In our toolkit, there's several little acronyms that are listed that you'll be able to see and you'll have access to after this presentation. But there's a lot of different devices, and I have a very high-tech device that I'm going to show you today from Tobii Dynavox. I also wanted to mention, though, that with technology today, with iPhones and iPads, a lot of people are choosing to use these methods of technology to help them communicate. And we had talked about the speech-to-text for folks who are hard of hearing or deaf. We also have text-to-speech. So someone who has trouble communicating can use text-to-speech to type into an app, and then it will speak out loud. So I wanted to show y'all some of those today. There are some slides that will kind of show because this is so small and difficult to see. But on my iPhone, I have an app called Proloquo for Text. So this shows you a screenshot of what my screen might look like.
Hello. How are you? It's nice to see you today.
Okay, somehow I have chosen the voice of a little monster. I'm not sure how it got set to that. That is actually not the voice that I preferred to have it on. Let me change that really quickly. Okay, we'll use Tracy. Okay, sorry about that. So that's fun. There's some fun little options. But you can use this app. This has some pre-programmed messages that are here. You can go in and set up pre-programmed voices and messages for medical appointments. So you can go in and talk about what diagnoses you may have, what types of medications you're taking, so that you're not having to type all of that information at one time. Those can be quick. You can hit one button and it can speak a whole message, such as this.
I can understand everything you say, but I use this program to talk because my speech is hard to understand.
Okay. You can see that with someone who has complex physical impairments as well as communication disability, they're going to have a hard time accessing a small device like this. So they may need an iPad, something that's bigger. You're still going to have quite a bit of dexterity to use something like this. I wanted to demonstrate one app, and it's called LAMP Words for Life. And there's a slide that...
Is that it?
Yeah, no, that's a different one. Let's see if we can go back. It's that one. Okay, so this one you see has a lot of pictures and single words. This is a word-based program, but this is for someone, even though there's pictures there, you know, as a completely cognizant adult communicator, I could use this and I almost would learn this as my own language. Every one of these words can navigate to other vocabulary. There's full verb conjugation. You can go in and build thoughts and words and sentences however you want to. There's also a full keyboard that can do the text-to-speech. So this has thousands of words that come pre-programmed. You're not having to go in and make pages of activities and things like that, and you can pretty much say anything that you want to say. I typed in this one.
I want some chocolate, please.
Okay. So this, of course, has a young child voice. I particularly work with young children with difficulty communicating. I wanted to also mention, I mentioned before, a lot of people who have complex communication needs may also have severe physical impairment. So there may be other ways that they need to access this equipment. So they can't always use their hands to access a device. Unfortunately, some people don't have use of their upper extremities, so they have to use switches or their eyes to communicate. So this is an example of a basic switch. This can be mounted to someone's wheelchair or to a table next to them if they're sitting somewhere else. They may actually have to use their head to access a communication device. There are several ways this can happen. It can be attached to a single message voice output device like I demonstrated at the beginning, these small ones. Or it can be attached to an iPad with an app and allow them to scan through choices. They will see the pictures be highlighted as it scans through, and when it reaches the one that they want, they'll hit the switch. So there's several ways in which a switch can be used. They may simply lean over.
Hello, how are you? Hello, how are you?
Okay, so they may have to use their head. They may use an elbow or a knee or even a foot. We've had a client who has even had an iPad mini mounted to his footrest, and he could actually use his toes to communicate with the LAMP Words for Life program that I demonstrated just a moment ago. So if you see someone, these switches may be incorporated into the headrest of a wheelchair, they may be in the footrest or somewhere along the chair. If you see something like that, then that's probably a way in which they're going to communicate, or sometimes it's also a dual purpose, and there are also ways in which they may operate a power wheelchair. So these are pretty inexpensive pieces of technology that can really open up a lot of doors for folks. Moving forward, talking about people who have severe physical impairment in addition to communication difficulties. This is a Tobii i15, and this is an eye gaze communication device. You can see that there's quite a few pictures on the screen and some single words. The bottom portion of this device here is a camera, and it actually will watch the person's eyes. You can calibrate this device to someone specifically. It will learn the way that their eyes move, and they just simply have to look at the screen to activate a button for the device to speak. Certainly this is probably the highest tech piece of equipment that we work with regularly, and it is quite expensive, so these things are covered by medical insurance. This device itself is a little over $15,000. So it definitely is an amazing piece of technology for people with severe physical impairment. They may be quadriplegic from cerebral palsy or from a traumatic brain injury or spinal cord injury and not be able to communicate. So I can quickly demonstrate how this would work, and hopefully you'll be able to hear it. Okay.
I use this communication. I use this communication device to help me speak. I use this communication device to help me speak.
So I looked at it several times, so it said that message a few times. But I simply looked at the screen and navigated to another page to have it speak that message. So this is highly customizable for the person, and it can be used from anyone from a young child who's just learning to use a communication device all the way up to a conversational adult user. And I also wanted to talk about etiquette when speaking with a person who has complex communication needs. This is really going to be repetitive of a lot of the other speakers who have talked about this today. But again, probably the main one would be to talk directly to the person who has a complex communication need. They may or may not have a companion with them. If they do and they have trouble understanding, then the caregiver is likely going to let you know that pretty soon. If not, though, you definitely need to speak directly to the person that you're communicating with. Certainly don't talk about the person in front of them. You want to talk directly to them and ask them questions. Do not talk loudly to someone just because they have difficulty communicating with you. They do not necessarily have a hearing impairment, so you'll want to talk in a normal speaking voice and a normal tone. Do not assume that if someone has a difficulty with communicating that they also have an intellectual disability. On the contrary, a lot of individuals who have difficulty communicating may have very high cognitive skills, particularly if they're using very complicated equipment and language systems. You can assume that they understand everything that you're saying to them at a normal conversational level. When speaking to someone who has difficulty communicating, you want to speak to them as you would at any other person of their age. You know, you don't want to speak down to someone who is an adult that's having trouble communicating. You also don't want to, if you're talking to a child, you want to speak to them as a child, just as you would any other child their age. It's important not to finish someone's sentences when they're trying to use their communication system. These things take quite a while. It can be difficult at times to complete a very detailed thought, so you don't want to complete someone's sentences or guess what they're trying to say before they're finished. You want to give them ample time to finish their sentence and let you know exactly what they think about something. It's important to be honest with someone. Definitely let them know if you don't understand. Certainly some people with communication disabilities may have communication devices, but they also may be very verbal. So you want them to have a chance to use their voice to speak to you, but if you are having difficulty understanding them, just be honest and ask them, you know, or let them know that you're not understanding, and they may go to their communication device to help you understand. As I mentioned before, if someone's using a device, just give them ample time to complete their thoughts, and also give ample pause time. If there's multiple people around, give pause time to allow that person to join into the conversation. You want to pause and look at them and include them in the conversation just like anyone else that's sitting there. And finally, it's important to not just ask yes/no questions. Sometimes that may be the only way that someone can really effectively communicate is by answering yes/no questions, but it's important to really get someone's detailed thoughts if they have them. So try to ask open-ended questions and give someone an opportunity to communicate their answers to you. So.
All right. Thank you very much, Karen.
Thank you.
All right. I think just wanted to mention the stuff that will be in a toolkit that we're putting together. And I know at the very beginning that was excellent dialogue on the legal requirements. I know that kept all of you very wide awake, but I appreciate you bearing through that. But it's very important that you understand where all the stuff that we're talking about today comes from. All the requirements we talk about for effective communication and the different devices that we've discussed so far. In this toolkit, I have listed all of the regulatory material I had at the beginning of the presentation that I kind of glanced over in some respects. A lot of it was repeated throughout. You'll notice in today's presentation we had quite a bit of repetition. We have repetition too, okay, but quite a bit of repetition on purpose because some of it is complex in trying to help you understand. So the Title II and III regulations, you remember Title II covered public entities and Title III covered private businesses. We have those listed fully in the toolkit that we're putting together. Also, legal guidance that came from the federal government. The federal government actually enforces the Americans with Disabilities Act and these requirements. They have an excellent document called Effective Communication for Students. So a lot of student settings, and then also they have a Department of Justice that we've abbreviated DOJ has an effective communication overview. And again, the other part of the toolkit that we have, emergency situations, because, of course, in an emergency situation, effective communication becomes critically important. And this is the state of Texas developed this one. It's a good template you may want to have developed for your own entity. And then, of course, the National Council on Disability, abbreviated NCD, has guidance on emergency situations. And the thing that I wasn't aware of my own technology up here last time, so bear with me. I'm going to give this to Renee. This is the effective communication policy. You cannot see this. We have posted it, but give you an idea of on the document cam. If you could kind of scroll through that and do the next page just for let you know it's several pages. And it's very well thought out. Again, certainly a good something that will be in the effective communication policy. And I assume that all of you have a good screen reader at home and CCTV, so you can blow that up. So I'm just kidding. Other part of the toolkit, we have a listing and pictures, and you've seen in this PowerPoint today some of the different types of device we have. In auxiliary service that I also want to help you define, those are any type of accommodation that enables effective communication. And these are example. We've got some listed for folks that are deaf and hard hearing. You saw our two persons describe that, and then we had blind and visually impaired, and then cognitive impairments and deaf-blind impairments, speech impairments, and then there's also something called a universal travel book. The universal travel book has pictures of different situations in it that people can point to. And it's a lot of times it's used in people when they go to foreign countries and they don't know the language. But I also think that it could be helpful in causing effective communication. And then, of course, in the toolkit, we're going to have resources and vendors listed. And then we have acronyms. All these abbreviations that we've been using, like SSP and some of the CCTV, have all these things spelled out so that you can become pretty knowledgeable about effective communication. And now, and we have a little bit of time left, and I'm going to briefly go over some of these scenarios. We made all these promises at the beginning, and hopefully we have fulfilled the promises we made at the beginning. I have a few scenarios, and these, as I like to say on the scenarios, the names have been changed to protect the guilty or the innocent. They're basically based on real-life situation. The first one, dealing, and I made up these corny names just to make a point, but Wayne World, this is something having to do with a public entity and a concert hall and the lack of effective communication. This is somebody who's deaf, loves to listen to the vibrations and music. The concert is held at the local civic center. It was built way before the Americans with Disabilities Act. Our individual with a disability who's deaf requests an interpreter. He's told that he'll have to pay an additional fee on his ticket to cover the cost of the interpreter. What would you do? Has there been a violation of the ADA? Of course, we talked earlier about surcharges, and the surcharge is where you charge a person with a disability the cost of the accommodation. So if you provided Braille, you charge for Braille. If you provided a CCTV, charge for that. Or if you, of course, any other type of, you provided an assistive listening device, charge for that. These are things that would be an obvious violation of the ADA. And again, we talked about being able to pass the cost of that over to other customers and doing a charge. Do you realize if you still have a landline today, that you pay a 15-cent charge in every phone bill to pay for the relay system in Alabama? And that's raised much more money than the relay system has actually cost. So that money is actually put in a pool to help buy other assistive technology for people with disabilities. And there's the same scenario, except the individual disability goes to a movie theater to see a picture that has no closed captioning. And really today where we see the most closed caption issues are when people use YouTube videos. A lot of us have looked at YouTube and they don't have, or they have very poor closed captioning. So if you do use YouTube videos to demonstrate a point, make sure that the captioning is accurate. And sometimes you may have to go in and add another text box or something to provide better captioning. Okay, and this second scenario, and I mentioned that already about closed captioning. The second scenario has to do with somebody who uses a wheelchair for mobility and is profoundly deaf. And you're going to have situations, we kind of alluded today, where you have somebody with more than one disability. Maybe a mobility disability, also patterned with a type of sensory disability or visual or hearing impairment. He goes to the doctor's office to get treatment for heart problems. He only communicates through American Sign Language. He shows up, and I named the doctor as I.B. Stingy, okay, very original, but and demands an interpreter. Stingy refuses. Can he do this? If no, if yes, why? If not, what should be done? And again, there's no such thing as interpreter on demand, but if somebody that's deaf calls up, calls up through the relay service and says, I need an interpreter, I'm going to be meeting, my doctor's appointment is this date, that should be enough time to try to secure an interpreter. Where we have seen in medical setting, many doctors say, well, I can't afford to pay for an interpreter. The service only costs $50, an interpreter is going to cost me this much per hour. It will cost more than the actual service. Now, a doctor in that case may be able to pass the cost of an interpreter to all of their patients, kind of like the relay service where you get the 15% charge on each bill that comes out. So again, we still see a lot of doctors' offices that may be reluctant to provide interpreters. Scenario 3, this is the employment. Remember at the beginning we talked about the different scenarios that effective communication could apply to. This one has to do with somebody applying for a job at a law firm. And the name of the law firm is Dewey, Cheatham, and Howe. Very original too. He walks in offices for an interview. The individual with disability's name is Abel. He uses American Sign Language to communicate. He has an interview with the managing partner, I.B. Great. And go on the next slide. This is a longer scenario because it involves a law firm, so it's got to be a little bit longer, okay? This one, Mr. Great sees that Mr. Abel is deaf but insists on using written notes to communicate. Abel requests an opportunity to reschedule when an interpreter can be present, and Mr. Great refuses. Has Mr. Great done anything illegal? If so, what would you advise? And I do not always advise somebody to sue just because I'm an attorney. I advise them to work it out. But in here, the fact that he asked to reschedule, and I would think in an interview you're sharing very complex information. I don't think written notes would do an interview justice. I think an interpreter would be applicable here. It would be required. So this is a case where sharing information through written notes isn't going to convey somebody's personality or their knowledge. It's going to be very broken up. So, and I think I have one more scenario I'd like to share, then I'd like to open up for questions, see if we have questions. So this is scenario number 4. Obedient or obedient daughter schedule appointment for her elderly mother to visit the doctor. Her mother is deaf and requests an interpreter, which the doctor refused to provide, citing expense. The mother is going to have a physical done. And this is the scenario of when we talk about associative discrimination, where the person, the daughter is bringing somebody, the daughter doesn't have a disability, but the mother does. The mother needs the effective communication. The daughter is discriminated against too because the mother isn't effectively communicating. And again, in a physical, the way to analyze it, physical, many complex information. If something is revealed, the doctor should want to be accurate in disclosing the results. So again, very complex communication. And what if the doctor only accepted Medicaid clients? What would be the significance about that? Many people argue that Medicaid doesn't allow for payment for interpreters, or it doesn't allow the cost to be spread among different, they couldn't get a per share cost from another client because they need an interpreter. So cost sharing may be prohibited under Medicaid, so that's another thing to consider. So I would encourage you to go back and look at these different scenarios and see if you can reanalyze them using the legal information that we shared. The last scenario has to do with a deaf employee, scenario number 5, who was not given an interpreter at monthly meetings in which they discussed benefits. And this individual didn't know they had retirement benefits, or didn't know that they did not have retirement benefits, because in those monthly meetings they were told how to apply for retirement benefits. So 20 years past, 25 years past, the deaf individual doesn't realize they don't have retirement because they didn't provide effective communication. So in the employment context, effective communication is very important. We've shown that it's been very important in any type of medical treatment scenarios where there's mostly complex information shared. All right, and the rest of the scenario, I've not gone over it for its save time, but I encourage you to go back and look at it. So this is the part we wanted to see if there's any questions.
Do we have any questions?
Yes, we do.
All right.
One question is, there aren't enough interpreters. What do we do?
All right, that's a great question. If you cannot get an interpreter, then consider other alternatives. And one alternative that we discuss is video remote interpreting, or even if you're in state using FaceTime, where you can find an interpreter somewhere else that's not your location, and that person could interpret using a video phone or FaceTime. And sometimes you might consider written notes in a worst case scenario where you couldn't find an interpreter. Or remember when I talked about all the interesting regulations, I say that in, kind of facetiously, interesting regulations at the beginning, you could also try to use a family member in very rare instances where you couldn't use an interpreter and where confidentiality was not an issue. Or even a minor child, in an emergency situation where there was not a qualified interpreter available.
Any other questions?
Yes. What are some resources for auxiliary aids and services?
Well, we have many good resources here today. One, it could be possibly, if they're a client of vocational rehabilitation services, the Alabama Department of Rehabilitation Services could be a possible resource. Then also, another possible resource would be the Alabama Institute for the Deaf and Blind. The Department of Mental Health is another resource, particularly with issues related to mental illness and deafness. So, and of course, the Governor's Office on Disability, I got to plug my own program a little bit, okay, but I didn't want to just plug my program. The Governor's Office on Disability can be a great resource for identifying statewide resources. And of course, all the other divisions within the Alabama Department of Rehabilitation Services, such as Children's Rehabilitation Services, Early Intervention Services, the Older Alabamian System of Information Services for the Older Blind program. So.
And then, why should we be concerned about the populations that use these devices?
Because the greatest risk factor for disability is age. And a lot of the disabilities we describe today will occur because of age. Hearing loss, vision loss, speech impairments, cognitive disabilities could occur. And according to the Centers for Disease Control, Alabama has a disability prevalence rate of 31.5%. 31.5% of our population has some type of disability, and a large part of that population are people who have hearing or visual impairments or speech impairments or cognitive disabilities.
Are there any questions from the audience? Okay, well, Graham, I appreciate so much the information you presented, as well as all of the guest speakers too. And I also want to remind our viewers, if you are an employee of the Department of Public Health, we have a contract with the Alabama Institute of the Deaf and Blind. So if you need an interpreter, then we already have that contract in place. Also, I want to thank our partners in this, the Governor's Office on Disabilities, the Alabama Council on Developmental Disabilities, as well as the Department of Public Health's Disability and Health Program. So until next time, we'll see you later. Okay.
Thank you very much for your attention. It's been our pleasure to present today. Thank you.